Hi, my name's Alexander Boss, and I'm a student physical therapist currently enrolled at the University of St. Augustine. And today I'd just like to take you through my critically appraised topic on the effects of deep cervical neck flexor training on chronic neck pain. And I'll be scrolling through it so you could pause and read through the article as you like, but I'm just going to give a brief summary of what I found. And starting off, here's my background, just why I chose the topic that I did, and my PICO question, as well as the databases and search terms I used to find my articles that I used. And here's my introduction, basically talking about the prevalence of chronic neck pain and how it affects people's lives and why it's important to study how to fix it. And the first study that I looked at was from Iqbal et al. It had 50 people, 25 in each group. In the experimental group, they worked on deep cervical flexor training as well as conventional training, and the control group just used conventional exercises for neck pain. And the outcome measures used were the numeric pain rating scale to measure pain, the craniocervical flexion test to measure the endurance of the deep cervical muscles, and the neck disability index to measure functional disability. And then here is the Pedro score and the eligibility criteria. And the next article was from Kim and Quag in 2016. They had 30 people initially, but one person dropped out on each side, so it was 14 in each group. In their experimental group, they looked at deep cervical neck flexor training, and then the other group looked at just general strengthening exercises for neck pain. And the outcome measures were the NDI numeric pain rating scale, and they looked at different postural angles. And then the last study was from Gupta et al. They had 30 participants, 15 in each group. Experimental group looked at deep cervical neck flexor training, and the control group looked at conventional isometric training. And they used the visual analog scale for pain and NDI to measure disability. And down here is basically an in-depth look at the results found in each paper. And here is my discussion where I basically talk about what I found and what I think it means for deep cervical neck flexor training. And basically, what I found was that all the different studies that they found that both groups actually improved the patient's neck pain, but in pretty much everything. But the deep cervical neck flexor training groups, the experimental groups, were actually improved more than the control groups in basically everything that was found. So I do think that deep cervical neck flexor training is a good thing to add into a patient with chronic neck pains program to help them improve. And I do think more study needs to be done in this area. Like, should both be used? Should deep cervical neck flexor training and conventional training both be used? Or is deep cervical neck flexor training enough? How much should you do it? How long? How many sets? But it does seem that doing these exercises does help improve the patients, and getting their deep cervical neck flexors stronger will help them improve their neck pain and hopefully alleviate some of their suffering. And here are all my references.